Dear students, we are at the beginning of the second half of the chapter Cranial Nerves. You remember from the last presentation that we completed the nerve number 8. We still remember that nerve number 8 was specific, special sensory, and the next one is nerve number 9, glossopharyngeal nerve. The glossopharyngeal nerve is mixed, and on the first simplified table, we will try to explain all components and nuclei and also function of each nerve. So starting with the nerve fibers, as we said, it's mixed nerve. Starting with the number 1, afferent, general sensory fibers. Concerning the ganglion, this is the ganglion belonging to nerve number 5. You probably remember that we defined described three nuclei of the nerve number 5, and via this nerve ganglion or neural ganglion nerve number 5 run also the fibers of this nerve glossopharyngeus. Concerning the function or area which is supplied by the nerve for general sensation from the posterior 1/3 of the tongue, plus tonsils, skin of external acoustic meatus, and also internal surface of the tympanum in the middle ear or tympanic cavity. So this is first part of the table. So next page. Excellent. And also it was pharynx and tuba auditiva. So the second type of the fibers are visceral sensory, again afferent. They pass to the nucleus of solitary tract. This nucleus is long one, as we see. At the central portion, this one has the specific part of the receptors. Which ones? No, these receptors receive, or better send the information from the carotid body. We remember that carotid body lies in the bifurcation of the common carotid artery dividing into the external. We know why external, because here the first ever branch is a superior thyroid artery, and here we see the bifurcation, the carotid body, and also here we have the carotid sinus. Carotid sinus contains the baroreceptors. Carotid body contains the chemoreceptors, pH receptor. So from these, the carotid body and the other receptors run the information to the nucleus of solitary tract. The fiber number 3, special sensory, again afferent, finally reaching the nucleus solitary tract, the gustatory. The name gustatory means the nucleus receiving the information from the gustatory buds from the taste, so carries taste from posterior 1/3 of the tongue. We probably still remember that tongue has a complicated innervation, not only in the sense of the motor sensory, special sensory innervation, but also that the anterior 2/3 are innervated by the coda tympani. I mean the gustatory system. Then posterior 1/3 via the nerve number 9, and the area around epiglottis via the fibers of the nerve number 10. Concerning the type of the fibers, branchial motor efferent, these are somatomotor from the nucleus, which will be common for the nerve number 9, 10, and 11, nucleus ambiguous, innervating style of pharyngeal muscle. The last one is the visceral motor. Visceral motor means the parasympathetic. So these are parasympathetic fibers. They originate from the inferior salivatory nucleus. Concerning the nuclei, we will specify them together with the brainstem in the central nervous system chapter. But we already mentioned the names salivatory nuclei when we explained the parasympathetic ganglia attached to the different branches of the nerve number 5. This inferior salivatory nucleus innervates the parotid gland, we know that parotid gland is innervated by nerve number 9. And then also we see the control of blood vessels in the carotid body, definitely, because the carotid body has the branches of nerve number 9 and nerve number 10. So on the button, so the next, we can go up a little bit up. Yes, there is the simplified diagram showing the ramification of the nerve number 9. Of course, better diagrams you can find in the atlases. This is just the short introduction. We see the brainstem. Here we see the ganglia, superior inferior ganglia of the nerve number 9. Then the fibers that pass through the tympanic plexus to the parotid gland, parasympathetic innervation. Then also the branches which go to the carotid sinus and carotid body, also mentioned before. And then the distribution of the branches innervating the palate, soft palate, tonsils, then tongue, posterior 1/3, as we said, and also the branches to the pharynx. We know that the pharynx receives also the fibers from nerve number 10, because there is the pharyngeal plexus, which consists of the nerves number 9 and number 10. So this is nerve number 9. The following nervus vagus, vagus, or vagal nerves, we see on the table, which have the same components, which must contain the same components, starting with the fibers. The first one is the general sensory, afferent, same as number 9, nucleus tractus spinalis belonging to nerve number 5, and we see the impulses coming from concha of external ear, auricle, then external acoustic meatus, then again part of the tympanic membrane, then pharynx, larynx, and posterior part of the meninges. Second type of the fibers are the visceral sensory, afferent. Again, nucleus tractus solitary tract, the same. And then we see that it receives the information from the larynx, trachea, esophagus, thoracic and abdominal viscera. So there's a large area, the biggest one among all the nerves which originate from the brainstem. Then abdominal viscera. They are typical stretch receptors in the walls of the vessels, of the arteries, typically aortic arch, where we see the baroreceptors or stretch receptors, and also chemoreceptors controlling the pH of the blood. The third category comprises the motor efferent, innervating the branchial material or muscles of the branchial branches. There is the nucleus ambiguous, common for the nerve number 9, 10, 11, and nucleus ambiguous innervates the muscles of the pharynx, muscle of the larynx, plus levator veli palatini, and then small muscle which is attached within the wall of the pharynx, the salpingopharyngeus and palatopharyngeus. No? And the last category in this page is visceromotor, efferent. Maybe that the whole page will be better and clear the drawings. Yes. This one is again parasympathetic as the visceromotor efferent. It has its own nucleus, dorsal nucleus vagus, innervating smooth muscles and glands of the thoracic and abdominal viscera. So this is the common name, general name, because it innervates all the systems of the respiratory, the cardiovascular, urogenital, gastrointestinal. So that's why we use that, just the thoracic and abdominal viscera. And the number 5 is a special sensory for taste, again from the taste buds, nucleus gustatorius, the same as nerve number 9, innervating the area around epiglottis. So summarizing the facts concerning the nerve number 10, it is the biggest one, the largest one, the longest one among all the nerves of the cranial nerve category. So, and then follows the next page where we see the course. Next page. Correct. We see again the ganglia of the nerve, then the branches we already mentioned to the to the carotid body, etc. Then auricle, external acoustic meatus, then pharyngeal plexus together with the nerve number 9, then nerves to larynx. There are two nerves, superior laryngeal and inferior laryngeal. This is that one, via the recurrent laryngeal nerve. We probably remember that recurrent laryngeal nerve runs around the aortic arch on the left side and around subclavian artery on the right side. It's a long one and ascends in the shallow groove between the esophagus and trachea on the neck, reaching finally the larynx. Then the branches as the hemo or from the chemoreceptors. Yes, we said that under the arch of aorta lies the group of the chemoreceptors. Then we see the esophagus. Together with esophagus descends the plexus, esophageal plexus, passing through the esophageal hiatus and finally reaching the abdominal viscera. During the course, it also before that, of course, innervates trachea, bronchi, the heart, the cardiac branches, the whole gastrointestinal system. If we see the situation under the esophageal hiatus, so we are in abdominal cavity, excellent. And then we see that the intestinal complex innervates not only the small intestine, but also ascending and transverse colon, usually to the left colic flexure. There is a variety in the interconnection between the sacral plexus and the cranial portion of the parasympathetic system, but at the level of the left colic flexure, the descending part, or from this point, the descending part up to the rectum is supplied from the parasympathetic branches from the sacral plexus segments S2, S3, S4. Also, the branches supply also the urogenital system, that means kidney, ureters, and gonads. So we could say that at the end of the explanation, just simple explanation, a short explanation of nerve number 10, it has the biggest, largest area of the innervation, contains all 5 branches. That means it's typical mixed nerve. We go to the nerve number 11. This will be much more easy to see because the nerve 11, which runs together with the nerve number 9 and 10 through the jugular foramen, as we will see in the following on this page, on this diagram. So it has 2 parts, cranial and spinal, and has 2 branches, external, internal. If you look at this diagram, just for better orientation, we see nerve number 9 with 2 ganglia. As you see, the nerve number 10 with 2 ganglia. They leave the foramen jugular foramen, both 9, 10. They go to larynx, etc. And then we are at the nerve number 11. This has, as we said, 2 portions: cranial, we can call it also root or part, and also spinal, spinalis, root or part. From segment C5 to C1, they join together, passing together through the ganglion. Then they divide, and separated branch runs together. The internal branch runs together with the nerve number 10 to nerves innervating larynx, while the second one, the external branch, as we have mentioned at the beginning, innervates the typical skeletal muscles, trapezius, sternocleidomastoid. So we see that nerve number 11 is a little bit different in the course because it has 2 principal portions. One is the cranial and the second is spinal, and then 2 branches. One runs together with the nerve number 10 and one together. They run together and then separate finally to 2 muscles of the neck and the back. The last one is the hypoglossus. Hypoglossus is the nerve which is nerve number 12, is only motor nerve, and innervates, supplies the interesting intrinsic muscles and extrinsic muscles of the tongue. So simple innervating the tongue. Concerning the course, it originates from the motor nucleus of nerve number 12, passing through its own foramen, forming an arch, and finally reaching the muscles of the tongue. Specific situation is with the connection with the cervical plexus. We remember the cervical plexus consists of the motor and sensory branches. These are the motor ones forming superior root, inferior root. They form finally ansa. This is the interconnection between them. And ansa cervicalis runs in the short course together with the nerve number 12. It's not part of the nerve number 12. And as ansa cervicalis innervates one via 1, 2, 3, 4 branches, all 4 infrahyoid muscles. The position, we have to keep in mind always the topographical relationships. So we see that the ansa forms the arch around the internal jugular vein, and we see also on the lateral posterior part or surface of the internal jugular vein the chain of the lymph nodes, nodi lymphoidei cervicalis profundi, the profound deep cervical lymph nodes. So this is all to the cranial nerves. We completed all 12 pairs of cranial nerves in the short introduction in the lectures. So again, please do try to look at the axis of the or the basis of the cranial nerve chapter, which is relatively large one. Look at the diagrams in your atlases, in your books, and repeat and revise also the skull, important knowledge for the foramina that contain the nerves and also the vessels. Thank you for your attention.